I'm glad to have back with me, I guess, Dr. Souza, Hillcrest Urgent Care. First of all, thank you for being with us today. And we're actually filming this on Doctor's Day. So, first of all, let me ask you before we get started on our topic, what got you in the doctor business? Did anybody early in life play a part in that?
Well, I actually come from a family of doctors. My father's father was a founder of a medical school in South America and Brazil, and my father followed in his steps, and I also followed in his.
Okay, so a long line there. And we're going to talk about great program. You've really been thinking out of the box at Hillcrest Urgent Care. We want to talk about a value med program today. It's not insurance. I want to tell you that up front, but it's a membership. Tell me, and I know a lot about it, and I can't wait to talk about some of the things I love about it. But first of all, set the stage, Doctor. Tell us about Value Med.
Well, Value Med is a program that's designed really to help people that don't have health insurance to be able to afford health care. And health care costs have progressively gotten higher and higher, and more difficult people even with insurance. But with Value Med, becoming a member of a clinic like Hillcrest Urgent Care gives people access to health care that's available at the clinic. And in our case, that's a clinic. We have a clinic in Dublin, we have a clinic in Eastman, and we have a clinic in Milledgeville. We anticipate having a clinic in Macon by the end of the summer, and also a clinic in Albany by the end of the summer. So for people that are members, they have access to all those clinics as membership affords them. So with Value Med, people will pay a flat fee of $25 a month to be a member of the clinic, and then whenever they get sick, they will pay what's called a visit fee, which is similar to a copay, and that's typically $25 as a copay. It's a sliding scale based on the complexity of the visit, but in general, it's $25 for a visit.
Okay, Doctor. Now you talk about people without insurance, but one way I look at it, correct me if I'm wrong, but there's a lot of high deductibles out there now. 10,000, 7,500 is one I hear all the time. But even if you've got insurance, this program is great, isn't it?
It's great, and the trend has been in healthcare for insurance companies to encourage, in order to keep costs down, higher and higher deductibles. And now many people that have health insurance basically just have a major medical policy because they may have $1,000, $1,500, or $2,000 deductible. And in reality, in a year's time, most people don't spend $1,000 or $1,500 on the health care of that, even with primary care visits to places like Hillcrest Urgent Care. So I encourage people that have health insurance that have a deductible of $1,000 or more to consider Value Med because they will save money. In many cases, if they have an HRA or they have a savings account, the plan administrator will likely allow them to use that money to pay their Value Med program, both monthly $25 membership fee and the visit fees as well. And those fees also are deductible on their regular insurance. In other words, they can claim that file it on the regular insurance.
Well, we love our hospital in town, and you and I have talked before, and you pretty well sum it up in a good way. The airport's kind of like, the hospital's kind of like an airport, right?
That's right.
Sometimes you need the airport.
Sometimes you need, I think that when it comes to buying your own health care, you have to think like a consumer. And I tell people all the time that the analogy of airport is this. If you're going to go buy a hamburger, you're probably not going to buy one at the airport unless you're at the airport to go take a trip, because a $10 hamburger at the airport is not necessarily any better than the $1.50 hamburger that you can get across the street at McDonald's. So why would you go to the ER for non-emergency things that can be handled in an urgent care and pay roughly 10 to 20% of what you'd pay at the hospital? Hospital is a great place to go when you really have an emergency. But when you have minor emergencies that need immediate attention, it's much cheaper to come to a place like Hillcrest Urgent Care. And the analogy of the airport is that basically you wouldn't choose to go to an airport to buy a $10 hamburger when you can buy one that's equally good or perhaps even better at a local hamburger joint.
Now let's talk about some of the emergencies that we can handle at Hillcrest. Broken bones.
Yes, we basically all the full spectrum of minor emergencies, including trauma, broken bones, workman's compensation, lacerations, coughs, colds, flu, stomach virus. We have the capabilities of doing IV fluids. We have the capability of doing X-rays, ultrasound, EKGs, Holter monitors, and so basically anything short of imminent threat to your life or loss of limb, we have the ability to take care of there in the clinic.
And the average cost nationwide now of an EKG is around $1,000. It's only fractions. When you go to Hillcrest Urgent Care, you're talking about a fraction of the cost.
Yeah, I think, the average cost of an EKG may be, here in Georgia, maybe $150 or $200. And just to give you an example, I know our fee is like about $25 or $30
Wow.
for an EKG.
And lacerations, you can set a cast, anything to do with a broken bone, right?
The minor fractures we can handle. We normally, when people come in with major fractures, we stabilize the fracture and we make an immediate referral to an orthopedic doctor to take care of it that day.
Okay, what about colonostomies, steroid injections, things like that?
We do have at our primary clinic the ability to offer colonoscopies for folks that need colon cancer screening, and we have the ability to do joint injections or steroid injections for people that have chronic pain issues.
Okay, of course, you're open 7 days a week, right?
That's right, 7 days a week in all of our facilities. Same hours, 9 a.m. to 7 p.m. Monday through Saturday, and 11 a.m. to 7 on Sunday.
And the good thing about it, you don't need an appointment, right?
Don't need an appointment, and you can walk in. And our goal is to try to get people in and out there in an hour or less. And we've got a new system of tracking people when they come into the clinic now, where we're able to kind of stay cognizant of the time and make sure that happens. There are times during peak hours that we get an influx of people all at one time, and sometimes it can bog down for a little while. So it isn't always possible to do, but in general, we do try to get people in and out in less than an hour.
And you've assembled a great staff. I love Hillcrest Urgent Care. I love coming in there from the minute you get there. The girls up front, the staff, Phyllis, everybody at the clinic is there to serve the patient.
And that's by design. I mean, we really feel like that when people are sick, that they want to be handled with kid gloves and with utmost attention. And our philosophy really is to try to put customer service at the top as far as what we do. And obviously the quality care and the affordability is there, but we want to, besides making things affordable and providing good quality, we want people to feel like they're well treated and that their business is appreciated and that we're generally concerned about their welfare.
Okay, what if we want to sign up for the program? How do you do that?
It's simply, you can log on to our website, which is hillcresturgentcare.com, or they can call the corporate office at 304-1268 and arrange through either of those avenues to become a member.
And the number's right there on the screen. Put that in your phone. You never know when you're going to have an emergency. We don't. That's why they call them emergencies, right? We don't
That's
plan
right.
those kind of things.
They're never planned.
The number's on the screen. Like I said, the website, great website. Go there. The ValueMed program, I tell you again, it's not insurance. It is not an insurance program. It is a membership plan. And let's recap it before we go, Doctor. Insurance or not, I think we both agree it's a great program.
It's a great program, and I think it's very affordable. You're talking about $25 a month for the membership, and then you figure an average person comes in 3 or 4 times a year, then they're going to have maybe $75 to $100 extra cost for the visit. Incidentally, the lab and X-ray fees that are associated with the visit are extra, but they're for example, the lab fees are all capped at a fixed fee of $18 for a lab test in the office.
Wow.
So, and the X-rays are capped off at like $49 for any type of X-ray. So, those are very manageable, very affordable fees, and it makes it where most people can come in and be treated and be able to afford the care.
And I know most of you probably thought you heard that wrong, but those are actually the fees that you pay at Hillcrest Urgent Care.
They are, and I think that it's one of the things about healthcare that's kind of puzzling to me is that we see that healthcare is basically rising in cost, while a lot of the technologies we have, like X-rays, are getting cheaper. And X-rays now can be done because of digital technology very, very cheaply. Yet most places are not passing that cost on the consumer, and we are, in our everyday efforts, trying to bring those costs down.
And you do a lot of diagnostic people, ultrasounds. You go a lot of places, it's very costly. You do ultrasounds.
That's right.
What's some things we hadn't mentioned?
Well, we do a Holter monitor. I think we mentioned
Right.
that. We do EKGs. We
Right.
do a simple spirometry, which is a breathing test. We do of course, the full range of X-rays, and we do respiratory treatments in the clinic. We do DOT physicals. We did mention that for truck drivers. We do the police officer physicals for the state, and basically all the occupational medicine and employment stuff for all the industries around here as well.
Okay, this time of the year, before we go, springtime, a lot of pollen out there. You seeing a lot of stuff like that, right?
We are, and I think that it's it's tough to stay. Even right now, I'm kind of hemmed up a little bit with the pollen myself, and everybody goes and gets that over-the-counter Zyrtec, which usually does the job, but sometimes you need a little extra help, and when you do, just come and see us, and we got a cure for that.
Thank you for what you do for our community, Doctor.
Yep.
For prompt professional medical care for you or any member of your family, you have a friend in Hillcrest Urgent Care of Dublin. Hillcrest Urgent Care is a complete medical facility employing board-certified physicians and licensed nurse practitioners and offering an observation room, 8 examination rooms, as well as a complete laboratory and x-ray facilities. They are sincere in handling all aspects of adult and pediatric primary care, including colds, flu, respiratory problems, and back pain or injuries. Hillcrest Urgent Care is trained in minor orthopedic injuries, minor cuts and lacerations, and minor accident treatment. They can inform you about preventive care and perform routine sports physicals. They accept most major insurance and offer a cash patient discount. Hillcrest Urgent Care, Hillcrest Parkway in Dublin. Call 478-296-2800. Trust your family's health to Hillcrest Urgent Care.